Greetings to one and all. This is Mahavir Jain, L.V. Prasad Eye Institute. It is nice to see so many friends, colleagues, staff of L.V. Prasad Eye Institute join us. We also have friends from Rotary Club of Hyderabad and Rotary International. We are also pleased to have with us friends and colleagues from Liberia Eye Center, Monrovia, West Africa. We are also honored to have with us Dr. Joseph Kaikula, Head, National Eye Program, Liberia. We have with us the Honorable Indian Consulate General to Liberia, Mr. Upjeet Singh Sachdeva. He's connecting from Washington, D.C. It is such a great honor to have you all. Thank you for joining the 21st and the first online Rotarian Dr. Rustam D Ranji Award Oration Program. As we begin, I request Rotarian President Mr. Tansen Pandey to formally welcome us and address the gathering, lead the proceeding further. President Mr. Tansen Pandey, please.
Friends, good evening all. As the President of the Rotary Club of Hyderabad, I now call the meeting to order. My friends in Rotary Club of Hyderabad, the members of the Rotary Club of Hyderabad, Director Dr. Prashant Garg of L.V. Prasad Eye Institute, Dr. Balasubramaniam, who is our friend for Rotary in having our annual program planned meticulously and make it happen. Thank you, sir. All the guests, Rotarians, Rotaractors of all the members, the Rotary Fraternity of District 3150, and guests from Liberia and overseas. And I formally welcome our awardee, Dr. Niranjan Pehre, to this annual program of Dr. Rustam D Ranji Rotary Award for the year 2020. It is an honor for me as the President of Rotary Club of Hyderabad to initiate today's meeting and formally hand over the award to you for the Rotary year 2020-2021. I will not make any delay in taking forward this meeting, so I'll do my Rotary formalities and quickly hand it over to you at the very earliest. So I request Moin to read out the four-way test.
The four test of the things we think, say, or do. First is it the truth? Second, is it fair to all concerned? Third, will it build goodwill and better friendships? And the fourth one is, will it be beneficial to all concerned? That's a very good thing. Thank you.
Thank you, Moin. Yeah. Now I request Rotarian Rizwan Haider to read out the thought for the week.
Our eyes are placed in front because it is more important to look ahead than look back. Thank you.
Thank you. Thank you so much. I now request the Director of L.V. Prasad Eye Institute, Dr. Prashant Garg, to help us understand more about L.V. Prasad Eye Institute and its public health initiatives. Over to you, Dr. Prashant Garg.
Thank you, sir. On behalf of the L.V. Prasad Eye Institute family, I would like to welcome all the members who have joined for today's 21st Dr. Rustam D Ranji Rotary Award Lecture 2020. We are associated with Rotary Club Hyderabad for a long period of time, not just for this lecture, but many other activities. And therefore, it will be important for me to give a brief update about the organization and its activities in the past 1 year. L.V. Prasad Eye Institute is a not-for-profit organization founded on October 17, 1986, with the sole purpose to create excellent and equitable eye care system that reach all those in need. It's a WHO collaborating center and is governed by two boards. The clinical activities are governed by the board of Hyderabad Eye Institute, and the research activities are governed by the board of Hyderabad Eye Research Foundation. The organization is based on the fundamental principle of providing eye care, which is reconciliation of excellence with equity. We are a value-based organization and have 5 values: the patient first, excellence in whatever we do, equity, integrity, and togetherness. As of today, the organization has 10 functional arms. It is not just an hospital, but the organization is involved in activities such as education, technology innovation, product development, advocacy, policy and planning, research, rural and community health, capacity building, eye banking, and vision rehabilitation. Currently, we are located in 220 centers. The number you are seeing on the screen was on March 2020. We now have 195 primary eye health or vision centers. The 195th was inaugurated last week. The impact of the organization in past 30 years or so has been that we have been able to reach to population of close to 30 million. Since Rotary was involved very closely with eye banking, I'll also like to highlight that we are the organization which has been successful in procuring more than 100,000 corneas, and close to or more than 50,000 of these corneas were distributed for corneal transplant purposes. In addition, on the research front, our group has published more than 3,000 papers with 51 PhD degrees being awarded.
Okay.
We are now catering to rural eye health and have a very closely linked pyramidal model. So as I said that in 30 years of eye banking, we collected more than 100,000 corneas, of which 58,000 were distributed to various corneal surgeons, including corneal surgeons of our group. In the past year, we collected 10,000 corneas. You can understand this growth has been phenomenal, such that in 1 year itself, we were able to collect 10,000 corneas, and close to 60% of these corneas were used for corneal transplantation purposes. Of these, half of these were distributed to other eye banks. The organization has received many laurels, and in the past year, one of our colleagues, Dr. Javed Ali, was honored with the prestigious Shanti Swarup Bhatnagar Award for his research work. The institute has been ranked as the best in ophthalmology in the country, and our two partners, the center in Bhubaneswar and Visakhapatnam, were also adjudged as the best hospital by the Week Hensa Research Survey. The Ramayama International Eye Bank in the last year was awarded with Dr. A.P. Shah Memorial Rolling Trophy for the best performance in eye banking. This year began with a tragedy of COVID-19 pandemic. The government put the lockdown and all the activities came to grinding halt. Our group thought that let this lockdown not lock us down. And they started working on various steps to protect our team as well as all the patients who are coming to us to seek care. And these steps start right from the time that a patient enters in the organization in the form of thermal screening, making sure we are following social distancing. All the patients need to go through a triage. Thereby, we are able to identify those at risk, and they are dealt with separately than general patient. Within the organization, there are various stations for hand sanitization. All the front desk and counseling areas have enough protective step to ensure that we are able to break the transmission from human to human. We have made sure that the waiting halls have enough spacing between so that social distancing is maintained. All the equipments are such that there is a reduced risk of transmission of infection, and all the staffs are provided with protective gears that not only safeguard their health but also ensure that the safety of our patients is ensured. Because of all of these efforts, we have been successful in really making significant growth in the service of our patients. And in the past week, we have been able to provide care to on an average 2,500 patients and perform close to about 270 surgeries every single day. My introduction will not be complete without talking about the Liberia Eye Center. The center is located within the John F. Kennedy Memorial Medical Center in Monrovia, which is the capital of Liberia. A dedicated team, the majority whom are Liberian, are working toward providing sustainable and affordable world-class eye care to all Liberian citizens, irrespective of their ability to pay on the same line as LV Prasad Eye Institute in Hyderabad is concerned. Last year, we were able to screen more than 5,000 citizens through community outreach initiatives. We were able to serve 14,000 outpatient, close to 50% of these were non-paying, and were able to perform 1,300 surgeries. Again, 60% of these surgeries were non-paying. You will hear a lot more from our colleague in Liberia, Dr. Niranjan Pehre. With these words, I will once again like to welcome all of you to this 21st Dr. Rustam Ranji Rotary Award of 2020. Thank you very much and warm welcome.
Thank you, Dr. Prashant, for the update. And also, every time the Rotary Club of Hyderabad is always with LV Prasad, and we look forward for more association of doing good in the world, where the Rotary International and the Rotary Foundation does do happen, and we will work hand in hand. Thank you, sir. We have heard about LV Prasad Eye Institute, what it is doing for the public health initiatives. We have guests who are non-Rotarians, so in view of it, I request K. Sharma, Rotarian K. Sharma, Director of Youth Service for Rotary Club of Hyderabad, to help us understand the participants of non-Rotary fraternity, what is Rotary International, and a little about Rotary Club of Hyderabad. Over to you, Rotarian K. Sharma.
Thank you. Mr. President, the distinguished guest speaker and awardee, Dr. Niranjan Pehre, the Director of LV Prasad Institute, Dr. Prashant Garg, Dr. Mahavir Jain, the distinguished scientist and Director Emeritus, Professor Brian Holden Eye Research Institute, Dr. D. Balasubramanian, our Vocational Service Director, Rotarian Past President, P.R. Gopal Rao, Rotarian Secretary Sampath Botla, members of LV Prasad Eye Institute, my fellow Rotarians, Rotarians, Annis, and guests. It gives me immense joy to be in the midst of this august gathering and to speak about Rotary. Rotary is a global network of 1.2 million neighbors, friends, leaders, and problem solvers who see a world where people unite and take action to create lasting change across the globe in our communities and in ourselves. We Rotarians provide service to others, promote integrity, and advance world understanding, goodwill, and peace through our fellowship of business, professional, and community leaders. Rotary International is primarily responsible for eradicating polio almost entirely from the face of the earth. The entire Africa, comprising of 47 countries, was almost recently certified as free from polio virus. Rotary continues to strive hard to eradicate polio virus from Afghanistan and Pakistan, the only two countries still not free from virus. Rotary had contributed 2 billion US dollars so far for the project to eradicate the polio virus from the world. Bill and Melinda Gates Foundation, which had donated 350 million US dollars to the Rotary Foundation for this project, has now committed to donate further 300 million US dollars during the next 3 years, during when Rotarians the world over will contribute 50 million US dollars per annum. The Rotary Foundation is today the biggest charitable foundation of the world. Founded in 1905 with just 4 members, Rotary has now 1.2 million members the world over, belonging to over 35,000 Rotary clubs spread across 200 countries and geographical locations. Every Rotary club is a unit of the Rotary International. Our club was chartered in September 1949 with 50 members. The charter was granted by the Rotary International to our club on the 31st of December 1949, making it the first Rotary club of the Twin Cities of Hyderabad and Secunderabad. Our charter president was Nawab Zain Yar Jang Bahadur, and the charter secretary was Dr. R.K. Bhandari. All the charter members were eminent personalities of Hyderabad. The club has the unique distinction of having a few presidents of India, governors of states, and state chief ministers as its honorary members. Many eminent personalities and leaders drawn from different walks of life have addressed our club. For example, Ms. Anshuda Kant, the CFO and Managing Director of the World Bank, was our guest speaker last month. Our former Prime Minister, the late Sri P.V. Narasimha Rao, inaugurated the Golden Jubilee celebrations of our club on the 22nd January 2000. In its 71 years of existence, the Rotary Club of Hyderabad had undertaken many service projects to benefit the community around it. Adoption of schools, providing them with toilets, drinking water, buildings, classroom, and equipment. Regular and continued assistance to organizations like Home for the Aged, Mother Teresa's Home for the Dying Destitutes, and the Home for the Street Abandoned Children. Construction of the first housing colony under a sum clearance program launched by the Municipal Corporation of Hyderabad, a non-formal education center, career guidance seminars, exhibitions and personality and leadership development programs for school children, houses for Latur earthquake victims, free plots for the families of a few Kargil war heroes, donations for provision of artificial limbs, a major project of immunization of 1 lakh children in government schools against hepatitis B, provision of sanitation and drinking water for an entire village near Hyderabad, regular health camps in rural areas, vocational excellence awards, distinguished citizen awards, scholarships to poor students, midday meal schemes, donations to poor schools, and assistance to disaster victims form a partial list of our club's executed projects. Thank you.
Thank you, Rotarian K. Sharma. Thanks for the better understanding of Rotary International and what they can do, along with our Rotary Club of Hyderabad, the oldest in the city. Now, I would invite the man who is behind the planning of this Dr. Rustam Ranji Award from the Rotary Club of Hyderabad, Director of Vocational Service for the Rotary Club of Hyderabad, past President Rotarian P.R. Gopal Rao, to help us to share who was Dr. Rustam Ranji and how come this Dr. Rustam Ranji Rotary Club Award was initiated. Over to you, Rotarian Gopal Rao.
Yeah. Thanks, President. Friends, this evening's felicitation, the award presentation ceremony, and I'm talking about the life of Dr. Rustam Ranji, are all to perpetuate the memory of Dr. Rustam Ranji, an ophthalmologist who was also the president of our club. This is an award given each year, each and every year by the Rotary Club of Hyderabad in collaboration with the prestigious LV Prasad Institute to an ophthalmologist or scientist with exceptional regard in memory of Dr. Rustam D Ranji, a well-known eye surgeon in his days in 1950s and 60s. He was a charter member of our club and subsequently our club president. Charter member means, he was there right from the beginning of the club in 1949. Dr. Ranji wished to leave a legacy to the Rotary Club of Hyderabad. In accordance with his wishes, his wife left a will bequeathing a legacy to the Rotary Club. On her death, their niece, Mrs. Roshni Patel and husband Bindu Patel executed the will, and our club was one of the beneficiaries. During their lifetime, neither Dr. Ranji or his wife whispered even a word of this to anyone. The Patels did not know where to look for the Rotary Club of Hyderabad, where we meet, where we do our activities, our projects, but took the trouble of hunting down the Rotary Club, although they had no contact, but they handed over the legacy. A couple of years ago, a further sum of about 8 lakhs out of the balance available in the estate after distribution was handed over by the Patels to our club. They attended the first award presentation ceremony on the 16th September 2000 and have been present whenever possible at the award functions through the years. Unfortunately, Mrs. Roshni Patel and her husband, Mr. Bindu Patel, passed away, and we sorely miss them on these occasions. Recall Dr. Rustam Ranji and his activities, his benevolence. Such sincere persons like Patels who have executed their uncle's will so faithfully are rare to come by and surely are a shining example of integrity. Instead of hunting for the club, they could have simply avoided the whole thing, but they didn't do that. In order to perpetuate Dr. Ranji's memory and his munificent gesture on a permanent basis, our past president, Mr. G. Nizam, and his family suggested that the Rotary Club of Hyderabad issue an award to be given each year to someone who has made a significant contribution in the field of ophthalmology. With the encouragement and guidance of Dr. G. N. Rao, founder director of LV Prasad Institute, who incidentally is also a club member, we could issue the award through LV Prasad. LV Prasad Eye Institute has selected an illustrious list of awardees in the last 20 years, that is from the year 2002, some of whom are.
Mahavir, request you to take it forward, and I think now it's high time for us to, we have known what is LVPI, what is Rotary Club of Hyderabad, how we initiated the award, and we also know that Dr. Niranjan Pehre will be receiving, he is the recipient for the 2020 award. And before we actually listen to Dr. Niranjan, maybe I request Dr. Pratik Chaugule to introduce our awardee, Dr. Niranjan Pehre. Over to you, Pratik.
Thank you, President Rotarian Tansangaru. Good evening to all my colleagues at LV Prasad Eye Institute and the distinguished members of Rotary Club. It is my privilege to introduce our guest speaker for today, the Dr. Rustam D Ranji Rotary Award awardee, Dr. Niranjan Pehre. Dr. Pehre was born in a small town in Ahmednagar, Maharashtra, completed his medicine from Pune, did his ophthalmology residency from Kochi, Kerala, and then completed his pediatric ophthalmology, neuro-ophthalmology, and strabismus fellowship at Ranji Rotary campus, LV Prasad Eye Institute, Hyderabad. Later, he joined as a consultant at the Kode Venkatadri Chaudhary campus, LV Prasad Eye LVPI, Vijayawada in 2010. He has been one of the main pillars of support at the KVC campus and a true ambassador of LVPI and eye care to people of Vijayawada and Andhra Pradesh. He has been a strong advocate of taking ophthalmology to people rather than bringing patients to an eye hospital, and has participated in several awareness drives, conducted painting and quiz competitions, given several eye care related talks to public and health officials, all the while providing his clinical services to KVC campus and LVPI round the clock. He also has a global reach with several presentations, talks, seminars, and workshops across the globe to his name. He completed an observership at the reputed Great Ormond Street Hospital for Children, London in 2019. He has also been honored as the member of Pediatric Low Vision Rehabilitation Committee of the American Association of Pediatric Ophthalmology and Strabismus Society for 2 consecutive years now. His passion has really been to care for the most undercared of the society, children with severe cerebral disabilities, who very often suffer from profound visual impairments, the extent of which are difficult to understand, let alone explaining it to others. But true to his nature, he has taken up this challenge as his mission for life, to care for such underprivileged beyond ophthalmology, which includes speech therapy, special skills, occupational therapy, physiotherapy, and much, much more. Also to create awareness of their needs and to inspire more participation from the medical and paramedical fraternity in caring for them. In spite of an impossibly busy-looking work schedule, he has mastered the art of work-life balance. He believes in taking care of his body, mind, and soul, as well as his family, absolutely necessary in order to pursue his mission longer. He regularly takes time out to visit Krishna River, and by swimming across it, he immerses himself into her peaceful flow and spirituality. A few months ago, he extended his family beyond Krishna, beyond Andhra, beyond this continent, when he joined the LVPI's Liberia Eye Center at the John F. Kennedy Memorial Medical Center in Monrovia. Liberia too welcomed him with open arms and honored him with a fellowship by election in ophthalmology by Liberia College of Physicians and Surgeons. On behalf of Rotary Club Hyderabad and LVPI, I invite an absolute legend, Dr. Niranjan Pehre, to share his new family and experiences with us.
Thank you so much, Dr. Pratik. Before we hear it from the man itself, we are in the pandemic, but we don't lose any opportunity. We take every opportunity. So we awarded the same thing virtually, and I request the admin to do the presentation, to share the presentation, maybe how our doctor is now honored with the Dr. Rustam Ranji Rotary Award. Thank you. Now, I'll not be a middle person anymore. I will now hand over. I congratulate first Dr. Niranjan Pehre, and also on behalf of Rotary Club of Hyderabad, we welcome you into our fold of being a part of Rotary through this lecture. Dr. Niranjan Pehre, over to you.
Thank you so much, everyone. Dear Rotarian friends, members of the LVPI family, several dignitaries from Liberia, my friend Dr. Joseph Kekula, who is the head of National Eye Care Program, who is sitting right here next to me, Mr. Upjit Singh Sachdeva, Honorary General Consulate of India to Liberia, who is joining us from the Washington, D.C. in USA. I would like to express my deep gratitude for this very special honor to receive an award in the name of a very distinguished ophthalmologist, Dr. Rustam Ranji. I take this opportunity to thank my institute, which is an exceptional health organization in many ways. I would like to thank my parents, my patients, my inspiring teachers, which include my late mother, dear friends, colleagues, and all my lovely family members for their support and encouragement over the years. Today, we are going to talk about working towards setting up a sustainable model of eye care in developing countries, a Liberian experience. I'm talking on behalf of the whole team, which has contributed towards this project. This is the African suit that I am wearing for this lecture, Be an African in Africa. Since we have audience from several walks of life here, to make it relevant to all, we thought of weaving a story out of it instead of making it a lecture. And while doing so, we will delve into the past, the present, and also try to look into the future. Let us start with the story of this little girl, Musu, brought by her mother, who noticed that Musu can't see well since a couple of years. An operation was done for her left eye 2 years ago elsewhere, but it was not successful, and slowly the eye went on becoming small.
Sorry, doctor.
An operation was done for her left eye 2 years ago elsewhere, but it was not successful, and slowly the eye went on becoming small. Now for the right eye, mother saved money and went to Ghana. After going all the way there, the operation was cancelled for some reason. On examination here, we found that her lens in the right eye was displayed significantly from its natural position and it had to be removed. We performed an operation to remove the lens, gave her glasses, and she gained 70% vision. Now, she aspires to go to school and become a nurse. Look at this Mr. Sulinto. He worked hard to become a school teacher, but had to discontinue his career due to his vision problem. We found that he has weakness of nerves in his both eyes. We call it optic atrophy, and there is no cure for it. But we tried our level best to help him, and after thorough assessment, gave him this magnifying glass. Mr. Sulinto is now back to life. He regained his career, all with help of the simple magnifier, which he calls as a second eye and carries it everywhere he goes. All this is happening in a small West African country. Let me ask you a general knowledge question. Can you name the only 2 countries in Africa which never got colonized? One is Liberia and the other one is Ethiopia. Due to its US connection, nobody tried to invade Liberia, and that makes Liberia as the first and longest surviving democratic republic in Africa. West Africa is a sub-region of Africa consisting of total 17 countries, and Liberia is one among those. You will often find this term Sub-Saharan Africa in WHO, World Bank, and UNICEF reports. It refers to 54 countries in Africa located below the region of Sahara. Since the term West Africa is more specific, you will find it more commonly used than Sub-Saharan Africa. Some of you may be thinking, why doesn't he straight to the point? Let's talk about eye care. That's what we are here for. But eye resides in a person resides in a community, and communities make a country. So before jumping on to the eye care in Liberia, let's first try to understand what is Liberia. Let us try to understand in brief the history, geography, people, culture. This is very important because that helps one know the place and develop respect for it, which is very crucial to enjoy what one does. And history also teaches us important lessons which can guide us mission. Before I get into details, I would recommend you to listen to this talk by a popular children's author from Nigeria named Ngozi about the danger of single story. Whenever media talks about Liberia or Africa, we mostly hear about sad stories, which are not false, but there is a lot of good stories which for some reasons do not get highlighted. Liberia is a small country located in the is nearly equal to that of the South Indian state of Telangana and population equal to that of Hyderabad city. There are 15 counties and each county has its own beautiful flag. Mother Nature has blessed this country wholeheartedly with natural beauty. There is greenery all around the year, everywhere. Look at this network of several rivers throughout the country that flow throughout the year. With heavy rainfall for 6 months a year, people here do not know what is scarcity of water. Soil here is rich in several precious minerals and metals, including gold and diamonds. If you love spicy hot food, rich in healthy carbs and proteins, then you would love the fufu, GB, damboy, and several spicy Liberian soups. Don't go by the humble look of this canteen close to our hospital. It's very hygienic and guaranteed that you won't get sick by eating there. And most importantly, the Liberian people, who are known to be one of the friendliest people. One actually wonders, how can such friendly people have a civil war? Half the population here lives in urban area and half in rural areas. There are 16 ethnic groups and each has its own language. The national language is English, but Liberian English is slightly different and can be a challenge for a beginner due to its strong colloquial accent to it. We have a sizable Indian community here. The Indian community recently contributed significantly in efforts towards containing the pandemic in Liberia. You will often find Indian buses and auto rickshaws on the roads here. Indian serials get dubbed in English and are very popular here. Liberia was actually set up as a colony for immigrants from the US in 1820. Liberia was formally announced and flagged as a close resemblance to that of the US after one US President, James Monroe. There has always This tiny country in West Africa has given 2 Nobel laureates and both women, Madam Elaine Johnson Sirleaf and Lima Bowie, for their outstanding work in bringing end to the 14-year-long civil war in Liberia. Madam Sirleaf then went on to build the country from ashes in her capacity as the president of Liberia, and Lima Bowie continued with her work for empowerment of women. Madam Sirleaf was the first woman to become president of a country in entire Africa. These books by Madam Sirleaf and the documentary The Dream by Lima Bowie are inspiring. Whenever I'm down, I refer to these to realize that the work that we have in hand is so small compared to what these women have achieved. Over 173 years long history, the regime of the President William Tubman is considered as the golden period of Liberia, and he is considered as the father of modern Liberia. He was the 19th president and served for 27 consecutive years. Due to the economic reforms that he brought, the economy of Liberia boomed, and in 1950s, it became the second highest growing economy in the world. The natural resources were properly utilized. Several social reforms were made, roads were built, townships were built, and this shows what is the potential of Liberia that can be achieved. Tubman was a visionary. With his foresight to build a sound healthcare system for the country, he built the medical college, the JFK Memorial Medical Center as the National Referral Center where we are located, and the National Institute for Training of Paramedical Staff. Tubman himself had eye problems, and in 1960s, he invited Israelis for an eye checkup. One Professor Isaac Michelson from Hadassah University came, examined the Tubman family, and also did a national survey about eye health in Liberia. Professor Michelson had a vision for setting up eye care in Africa and came up with the model of to serve, to teach, and to lead. This was a diplomatic plus humanitarian mission by Israel because Israel was a newly established country and wanted support of several countries. He made a 7-year strategic plan to make Liberia self-sufficient in eye care by all means. And later, this model was replicated in more than 30 countries. But in reality, the lead part of this mission didn't materialize for till 1989 when Civil War started, is fondly remembered here also. During the wartime between 1989 to 2004, the eye care in Liberia was mostly delivered through Mercy ship, which arrived here once in 3 to 4 years. Post-war, 2 NGOs came forward, the CBM and Sightsavers. They set up 3 eye clinics and sent 4 ophthalmologists for training to Nigeria. But these clinics did not do well after the NGOs left due to issues with sustainability and integration into the National Health Plan. There are several learning lessons in the history that we discussed so far that we need to learn from to make our mission successful. Then came LV Prasad Eye Institute. A lot of people ask, LVP in Liberia? How did that happen? And why Liberia? Why not any other country in Africa? So it all started with Madam Sirleaf's visit to India to receive the Indira Gandhi International Peace Prize in year 2013. She visited LV Prasad Eye Institute at the same time for eye treatment of a family member. After seeing the facility, Madam Sirleaf requested the institute to help set up eye care for Liberia. On her invitation, team from LV Prasad Eye Institute visited Liberia in year 2014 for assessment of situation, and that led to signing of an MOU between Government of Liberia, the JFK Medical Center, and LVPI in year 2015. Broad vision of this collaboration was to build a comprehensive eye health system which is appropriate, available, affordable, and accessible for all Liberians so as to eliminate needless blindness in Liberia by year 2030. These were the objectives of the Liberia Eye Health Initiative. 1, to set up a state-of-art tertiary level eye care center in Monrovia, and later set up a few secondary level centers and several vision centers across the country by year 2025. To build an active outreach program, to build training programs to train human resources needed for all levels of eye care, to actively get into clinical research to find answers to eye health issues in Liberia. The ophthalmology department of the JFK was transformed into a state-of-art Liberia Eye Center and was inaugurated on 25th July 2017. Handful of paramedical staff called as physician assistants were selected and sent to India to get trained as vision technicians, nurses, and the support staff. From India, 2 ophthalmologists, 1 optometrist and administrator were deputed as full-time staff stationed in Monrovia. 1 faculty from India used to visit for 1 week every month from different super specialties. They took care of patients who needed that super specialty level care and also supervised overall functioning of the center. I also visited here as a part of that rotation in 2018, and that visit changed my life. The magic that I felt in those 5 days, I live that magic every day here. We have an active outreach program to reach out to the underprivileged communities. We also have a school eye health program which has brought smile to several such students. The success story of our school eye health program featured in a recent report by World Bank. Public education is an integral part of our work, and we utilize several avenues for the same. From day one, we use electronic medical records, and we are one of those very few examples of successful long use of EMR in the entire sub-Saharan African region. While it facilitates patient care in many ways, it also helps to make system accountable on many fronts. Over more than 3 years, we have served more than 31,000 patients in the clinic, with more than 50% of them being gratis. More than 20,000 people were served through our outreach program. More than 2,600 surgeries of different kinds and complexities were performed, with more than 70% of those being gratis. Along with patients, our mission has positively influenced lives of several of our employees. Each of these employees have a story to share about the same. Eye care in the country was not given its due priority for years. Working closely with all players in eye care in the country, we brought a momentum to various aspects of eye care in the country. Moving towards the vision of making Liberia self-sufficient in eye care, a residency training program in ophthalmology was started in year 2018 in collaboration with Liberia College of Physicians and Surgeons. The program was designed in such a way that the residents would spend 9 months in Liberia and 3 months at LVPI Hyderabad. As elsewhere in the sub-region, it is very challenging to maintain a high-quality residency program for various reasons. But our strength has been our residents who are passionate about serving their countrymen, and we all together try to make the most of what we have. We strive hard to nurture socially responsible ophthalmologists who do not look at eye in segments and layers. Those who do not look at patients only as means to earn a living or to write research papers, but they feel responsible for patients' eye health, and through that ensure well-being of the individual and well-being of the community. And they're ready to walk an extra mile to ensure that goal. Our residents get smothered with a lot of questions throughout the day, and they get mothered too. They can't leave the clinic unless the assignments are completed, and they've forgotten by now what a relaxing weekend looks like. It all looks rosy and nice, right? But one shouldn't forget that all roses come with thorns. These thorns hurt and even bleed at times. But one should also remember that there is a reason for those thorns to be there. If one wants the roses, one needs to learn how to handle the thorns well. Healthcare is complex everywhere, be it developed world or developing world. All hospitals have their own unique set of challenges, and same is true with Africa too. We just need to embrace those issues and deal with them. It is well known that supply chain and availability of consumables is a big problem all over Africa. We soon realized that even if we do surgery for free, the prices of medications and glasses were beyond reach of majority, that even 1/3 of our patients were not able to afford those. So the treatment we advised remained largely on the paper. Starting from the root, working at each level of purchase, transport, taxation, we were able to bring down prices of most of the medications and glasses by 50%. Apprehension in doing so was naturally about sustainability. But on the contrary, Lowering the prices led to increase in uptake by 70%, which actually worked in favor of sustainability, and the basic mission of serving the needy was fulfilled. You plan everything well, reach the hospital with great enthusiasm, only to get disappointed to hear all possible reasons why surgeries cannot be done today. And you hear new reasons every day. Slowly, we learn to become friends with those problems. We learn to live with them peacefully. But at the same time, we started to find innovative ways to work around them. One may call it operational research, how to run operations despite challenges and deliver the quality. Not going into details, now our surgeries continue even if there is no water in the overhead tank, no electricity or fuel for generator, the sterilization machine doesn't function properly, laundry doesn't give linen, or there is very limited manpower to help in the operating room, or there is very limited supply of consumables. Through these experiences, we realized actually we can do a lot with little. Doing with little contributes not only towards the sustainability of the program, but also to the environment. Look at the amount of plastic waste that gets generated out of a cataract surgery. But one can deliver the same high quality with these mini instruments only. This especially becomes important in a setup where proper systems for a biomedical waste disposal are not available. One may ask, how to really work peacefully through such challenges without losing motivation? While there is no formula, but this is what works for us. First and foremost, be grateful for what you have. Thank God that at least have this. Many doctors in sub-Saharan Africa don't even get this. So understand the why first. Get to the root. Try not to be judgmental. Realize the fact that you don't know the full story. You're a newcomer here. And never forget the fact that you work in a totally different socio-cultural environment. Stay calm. That's when you find solutions. Go slow. Don't try to be revolutionary. String one bead at a time. Bring one chain at a time. Self-care is particularly important because if you get sick, the healthcare system here has several limitations. So one has to consciously follow preventive measures like exercise and diet. I find this book, Man's Search for Meaning by Viktor Frankl, very inspirational. It is about people who were kept in concentration camps by Nazis during Second World War. It analyzes what was different about those who were motivated to live despite facing several atrocities in those camps. There are several motivational quotes in this book which guide us in difficult times. I would recommend these two interesting movies that always inspire me: Invictus and King and I. Invictus is based on Nelson Mandela's story of making peace through football, and King and I is about a teacher from UK who goes to teach a king's children in Thailand. With all these strategies, we attained good momentum. We had 3 full-time faculty, 1 visiting faculty from India every month. We thought all is going well, and we were making several plans for future. And then came COVID. There was a lot of fear, anxiety of all kinds. Like everywhere else in the world, there was lockdown here too. We kept emergency services going and also online teaching for the residents. We spent 3 months that way, and then came the evacuation flight. What next? Lot of uncertainties in minds of patients, employees, and trainees. It is fascinating to see how history repeats. President brings and oversees Eye Institute to Liberia. Lot of investment of different kinds happens of time, talent, and treasure. These efforts attain a good momentum. Then comes civil war in 1989 and Israelis leave. And then comes pandemic in 2020 and Indians leave. We decided that we won't let this history repeat. We will stay back and continue the mission. That was the time when the pandemic in Liberia also was on significant rise and there was an atmosphere of fear. There were a lot of apprehensions and doubts about how this will be done, how that will be done, what if this happens. We were unsure of all those answers, but somewhere deep inside, there was a strong feeling that we will find all answers with time. And as a team, we decided to turn the situation upside down, and we answered all those hows over time. We not only did well, but we did several things that we did not do all these years. We had this 4-year-old boy with a life-threatening eye cancer in his left eye. The eye with the cancer had to be removed as soon as possible to save child's life. There was no way that an eye cancer specialist could come from India, and the child also could not travel anywhere. We decided to take up this challenge and fulfilled it successfully. We planned chemotherapy in consultation with colleagues in Liberia and India. These patients with complex eye injuries had to be helped without waiting for a specialist to come from anywhere. This old man has cataract in both eyes, but we cannot do surgery on him because his eyelids are turned inwards. So first we have to fix his eyelids. This man lost one leg due to diabetes, and now diabetes is affecting his eyes too, making him doubly handicapped. We somehow got a medicine meant for his treatment transported in an ice box. It was thought that if this medicine is transported in ice box, it cannot work. But since there was just no other choice, we thought of making an attempt and injected this medication in his both eyes, and it worked very well, helping him recover his vision significantly. This old man came to us last year with poor vision due to high eye pressures. We advised him to use eye drops for the same, but he could not buy. He came to us last month with complete loss of vision and again very high eye pressures. We performed surgery for cataract and high pressure in both eyes together, and after surgery, he could see well till about 2 meters. My area of specialization is pediatric ophthalmology, which deals with children's eye problems. Crossing several barriers, for the first time, we were able to do surgery for a 1-year-old child with cataract under general anesthesia. It is most desirable to have a specialist or super specialist for different parts of the eye. But when it comes to being effective in an underprivileged area, what matters more is a broad range of competence of high quality. Labels of being this specialist, that specialist become less relevant here. And what matters the most is, can you help the patient who is in front of you now? And can your students learn from you how to manage that patient? So one has to constantly keep expanding its expertise beyond formal training. Everything was going well. And one fine day, our cataract surgery machine broke down. Our biomedical technician said, "Sorry, doc, this is beyond my expertise." We said, "Let us try to expand your expertise." We got contact details of company engineers from India, and after trying for 4 days on video calls, finally the machine got all right. We had this brand new surgical microscope lying unpacked. And what we were told is that the company engineers need to come to install it. But our smart technicians could do it over video calls taking 1 week, proving that there is no need to fly in biomedical engineers anymore for such reasons to Liberia. There was a concern about how we will handle residents' training because it is a significant responsibility. They say, just throw a child into the water and they will learn how to swim. COVID forced us to do the same with focus on more practical and competence-oriented training. Residents slowly started getting on top of the things, always under supervision of the lifeguard. For recently, we rejuvenated our surgical wet lab. Surgical wet lab is the place where trainees learn eye surgery on animal eyes. Apart from learning different eye surgeries, we also found that these animal eyes are very useful to teach several examination techniques and also to teach how to use laser on the eye. We find these adaptations being much more cost effective than surgical simulators and other devices, which are often very difficult to procure in places like ours. Our innovation team in India has developed this virtual reality-based test for visual fields. It can be an important tool for glaucoma care in Liberia, and we initiated its use in the clinic, taking all safety precautions. Now, let me share something which is really unique. Many of you must have seen cataract in an eye following an eye injury. But I am sure that hardly anyone would have seen such cataract in such a patient. Through a common friend in the UK, we got an opportunity to examine a few chimpanzees with eye problems in a sanctuary of chimpanzees here. This helped us find another dimension of being an eye doctor and another level of compassion. We look forward to building on this association in a mutually beneficial way. We also completed a few locally relevant research projects, and one of our papers even got published in a reputed international journal. Fine. So overall, it looks like things are going well. But the million-dollar question is, for how long? Self-sustainability of healthcare setups in economically underprivileged areas is a challenging issue. If you go on internet, you will find that a lot has been written and spoken about self-sustainability of healthcare setups in Africa. This is a very informative and comprehensive document by World Bank on the same issue. And the conclusion at the end is not very encouraging. LVPI's model of self-sustainability is a time-tested, unique model. We establish infrastructure through donations and manage running expenditure through revenue generated from day-to-day operations. While generating revenue, we take from those who can and give to those who can't. And importantly, give with respect. So that's the LVPI model in brief. Next question is, can this LVPI model work in Africa? I lost my sleep researching and thinking about this issue initially when I joined here, and slowly came to this conclusion. We need to make things simple. These pictures that you see on the screen are not from any developed country, but they are from Liberia. If these expensive hotels, supermarkets, gyms, bars, spas, they all can do well here, why can't our eye clinic do well, which provides world-class eye care at such affordable prices? And with time, we realize that this indeed can work. It can work even during a pandemic when we are working at 50% of our capacity, and of that 50% surgeries are being done at no charge, and no patient is turned away because they cannot afford. In fact, our last month was the best performing month ever compared to even pre-pandemic times. So how did all this happen? Well, there are no big secrets. We did not do anything different, but we just continued to follow what the Institute has been teaching us over the years. Be available and maintain quality. We recently treated a patient who was being treated at one of the most reputed eye hospitals in Europe. And this is the feedback the family gave us. And this reaffirms our philosophy that be it Africa or Europe, being available and ensuring quality comes above everything. One must not forget that we achieve our mission through our people. So it is important that they understand your philosophy well. And for that, it is important to keep things simple and understandable. If we talk about vision, mission, goals, 10-year roadmap, and then a long document, people get lost. So keep things simple. Tell what is important today. How is it relevant for them and their families? Move bit by bit. Take care of them like your family. And slowly you will find that cutting through all the perceptions and preconceived notions, we all get aligned in the same direction. It is very important to set up systems that drive accountability. And one needs to be rigorous about it. EMR is of great help here. And we need to constantly keep innovating to find cost-effective ways of functioning. So what's our way forward? As per a survey done in 2012, about 25,000 people in Liberia suffered from blindness, that is very poor vision in both eyes. This is an example of making things simple. Saying that prevalence of blindness in Liberia is 0.5% doesn't make much sense to many. But if we say 25,000 people are blind, that's easier for most to understand. And cataract is responsible for 2/3 of that. And next common cause is glaucoma. Number of people with visual impairment are estimated to be 6 times of these numbers. So in short, the burden of avoidable blindness in Liberia is enormous. Most of these patients present in an advanced stage of the disease where hardly anything can be done. So the challenge is to find innovative systems for early diagnosis. Difficulty in transportation is a major limiting factor here. Hence, using technology for prevention, early diagnosis, and even treatment of minor ailments need to be explored. We have already initiated efforts in this direction, and we find it very useful. Through a survey of physician assistants in rural parts of Liberia, we created a WhatsApp group of physician assistants who send us queries about patients with eye problems, and many of them we are able to solve online. We plan to get closer to the communities with permanent infrastructure to provide high quality care, which is again appropriate, available, affordable, and accessible to all in the community. And this is an alignment with Institute's global vision of a world where no one is needlessly blind and those with unavoidable vision loss are able to achieve their full potential. We would like to express our gratitude to our supporters, especially the JFK administration, Government of Liberia, Liberia College of Physicians and Surgeons, Lions Club International Foundation, along with several other friends. Thank you everyone for your patient hearing, and thanks to the organizing team for giving me this opportunity.
Thank you so much, Dr. Niranjan Pehre. I tell you, we are proud of the Rotarians of Rotary Club of Hyderabad. Now we feel we are proud of you. Now being awarded the Rustam Ranji Award, you deserve it. And you showed your patriotism, passion, and the commitment for your profession. We salute for the outstanding work you are doing at a place where an opportunity to be treated well for the eye care. I think we are with you, and what possible ways Rotary can work hand in hand, even in Liberia. We will reach out to the Rotary clubs there and make sure that some kind of a commitment comes from them to reach out more needy and more for the poor people there. Dr. Niranjan, we will hold on for you for a minute before we proceed to the next presentation, because we have one or couple of questions to you, and I now hand over the proceedings to Dr. Mr. Mahavir Jain to moderate the Q&A session. Mahavir, please.
All right. Thank you so much. Thank you so much, Dr. Niranjan Pehre. You not only gave us economic, political, geographical, healthcare, how many hotels are there, and the challenges you're going through. I think you gave us a super. You just took us to Liberia for the last 40 minutes. So thank you so much for comprehensive efforts on ensuring that engaging everybody towards the talk. So I have few questions here. One question I'll read out for you. It says, any examples you like to share about innovative solutions to no water, no electricity generator? Like any innovative solutions which you are able to see in Liberia, with even with the challenges, they are able to innovatively manage those.
Yeah, sure. So if there is no water in the overhead tank, you can get water in the buckets and somebody can just pour it on your hands.
Beautiful answer. Yeah.
Laundry, yeah, if the laundry doesn't give you the linen, you stock so much linen and get it sterilized so that you have enough linen for next 1 week. And if suppose that also helps, we have a stock of sterile ready-made gowns which can be just opened and worn.
Wow.
We have trained ourselves to work. Suppose this instrument is not it, that instrument is not it, doesn't matter. We can still manage with whatever we have. There is no fuel for the generator. There is no electricity available from the electricity board. No problem. There are small UPS available which come for just $100. We put each of those UPS machines for each of the rooms and a surgical microscope, and our operations continue. If you want to go for a big UPS machine, it will cost you $15,000, $20,000 for the whole place. But if you take a smaller UPS for each room, it costs you just $100 per UPS, and that serves the purpose. So these are all the small solutions that we discovered over time.
Wow. Wow. I'll ask you one more question. Okay, we have few more coming in. How many instruments you could discard from a cataract tray?
Well, we could get away without using a crescent, teratome, side port. Instead of using 3 syringes, you can manage with just 1 syringe of 5 cc for everything.
I hope that answered. So we have one more question. It says, this is a personal question. It says, Niranjan, is your search for meaning for your life, has it ended in Liberia? Can you hear me?
Like it's frozen.
Okay.
I think so. And I said, I think, yes, I found my purpose.
All right. So any more questions you can drop in on my email. I'll pass it on and we'll try to answer those. All right. So we are just fast approaching towards the time. I'll ask one more question. You did share about the challenges and all. You did visit on 2018, and then that inspired you. But what inspired you to come back again, knowing the challenges existing in Liberia?
Well, I knew that there are challenges, but I also knew that they can be tackled. Yeah, how? I did not know at that time, but somewhere deep inside I knew that yes, we can handle all of those.
All right. There's one more personal question I'll ask out of curiosity of all the participants here. I think we have a lot of liking for the Indian food. And especially when we leave India, one thing we miss is Indian food. So how do you survive not having Indian food there?
Well, Indian food is available. Like I mentioned about our Honorary Consulate General, and he sends me food every day, Indian food twice a day.
All right, this is encouraging to hear this. So with this, we'll thank you so much. I think very deserving, very wonderful presentation from you, and congratulations on receiving the Rotary Rustam Ranji Rotary Award 2020.
Mahavir, can I make a comment?
Yeah, please, please, Doctor.
Former President of South Africa, Nelson Mandela, spoke about Mohandas Karamchand Gandhi. That you sent a Gandhi, we returned a Mahatma. So maybe someday Liberia government will tell you sent a Niranjan, we sent you a saint back.
TP, you are scaring Niranjan's wife now.
All right. Thank you so much, Dr. Das, Dr. Rao. Thank you for all the participants. I'll pass it on to Mr. President Tansen. All yours.
Thanks, Mahavir, helping us with something more serious and fun mixed in it. I think this is what I asked, the same question I'll ask to you, Dr. Niranjan. I take the leverage of being a president and asking the last question before we propose the vote of thanks. Yeah, you may not miss the food there. Are you missing India?
Well, yeah, many people ask that question because before coming here, I spent a short stint in London, and people say, oh, you're going from a developed part of the world to a very developing part of the world. And what I realized with time is that it is actually not the world outside that matters, whether it is developed or underdeveloped. It is the world inside you. What goes on inside you? What inspires you? What thoughts are there in your mind all the time? I think that keeps you happy. So I actually never had the time to miss India or any other place, but I certainly do miss my family.
That's, I know, somewhere I felt like goosebumps when you're telling that it's a commitment within you, which will not even, you're busy working rather than thinking about that. Yet again, congratulations and thank you, Dr. Niranjan. I request Mithilesh to be ready with the national anthem. Before that, let us hear it from the past president, Dr. D.K. Raju. I request him to propose the vote of thanks.
You'll have to unmute yourself.
Yeah, can you hear me?
Yes, sir.
So, those are lovely lines. It's not important the world outside, but what matters is the world inside.
You need to mute one of your instrument, please.
Yes. So I think what a lovely statement that was, and it's a great pleasure to actually give the vote of thanks. So we just conducted one of our club's flagship programs successfully. A great many people have contributed to this program on behalf of the club, and on my own behalf, I would like to express our gratitude to all of them. The reason we are here today is due to the great Rotary spirit and generosity of Dr. Rustam Ranji. Our profound thanks to him for leaving this legacy to the Rotary Club of Hyderabad. We thank the Rustam Ranji family who have executed the family will and passed on the fund to our club. A special thanks is due to Dr. G.N. Rao, chairman of L.V. Prasad Eye Institute, who is also a Rotarian of our club, who jointly with the late past president G.L. Narasimham of our club evolved this format and has supported and sustained this effort to this day. We had an excellent exposition by Dr. Niranjan, a young, dynamic and dedicated ophthalmologist. It was really informative, educated and enlightening. Rotary and LVPEI convey their congratulations and a very sincere and profound thanks to Dr. Niranjan for accepting our invitation, receiving the Rotary Rustam Ranji Award and delivering a brilliant oration. Thank you, sir. Continue. We thank the directors, Director of LVPEI, Dr. Prashant Garg and Dr. Pratik Chogle. Dr. Prashant Garg has superbly enlightened us on the hospital's global vision and its current initiatives. We thank Mr. Mahavir Jain, Administrator, PR and Donor Affairs and our club President, Rotarian Tansen, Advisor Rotarian Annapurna Shastri, and our Director Rotarian PR Gopal Rao. Our special thanks are due to Professor D. Balasubramanian, who is a distinguished scientist, for his immense contribution to this program. Thank you, sir, for all the help you have done, and especially recommending the name of Dr. Niranjan for today's talk. My thanks to the Rotary past governors, sister club presidents, fellow Rotarians, guests for their involvement and assistance in organizing this evening special event. Finally, let me thank profusely the distinguished audience who participated in this event and paid extraordinary attention to today's lectures. Thank you all of you. A great evening. Thanks.
Just to introduce our friend, he is Dr. Joseph Kekula, and he heads the National Eye Health Program for Liberia. He is a great friend of ours, and we all work closely together.
Thank you.
Wonderful. Thank you. Thank you. Thank you.
Thank you.
Thank you.
Thank you, Rotarian DK Raju, and also Dr. Niranjan for introducing you to your colleague. Thank you, sir.
Gentlemen, first of all, Dr. Rao, if you are listening me, he's a good friend of mine. I came in contact with Dr. Niranjan since he came visited Liberia, because I'm one of the directors of the eye hospital. But I can tell you, he's one of the most committed doctors who is so passionate about helping Liberians, especially the people who cannot afford children. And he has designed so many ways which I cannot explain to you to help people. He was giving me an example a couple of days ago when we met before I traveled for US, that the anesthesia machine which was operating in the JFK hospital, and the machine had a problem, and how he maneuvered his way. You know, I'm not going to explain the system he did to get the machine from the nurses and all that, so he can do surgery on eye patients, like the patient he explained about the cancer. There are such cases, and he has done his job in these difficult circumstances with so dedication and commitment. I have no words to explain it. Let me go further beyond that. I remember when this COVID was at very large scale, growing exponentially in Liberia, and there were four people, they decided to go back to India. I picked up the phone and I called. When Dr. Niranjan told me, I picked up the phone and called Dr. Niranjan and told him, Dr. Niranjan, if you all leave, all the hard work, Dr. Rao and every team, everybody, late Sam, Raj Shekhar, and the other doctors have put up to build up, this whole institution will be ransacked. And he understood me. He said, the problem is that I have the orders from Dr. Rao to go back to Liberia. So I picked up the phone. I said, okay, if you permit me and you support me that you want to stay, I will call Dr. Rao. So I picked up the phone, I called Dr. Rao, and I convinced him. I offered him that Niranjan can come and stay in my house even. He said, no, that is not the case. The case is, are you guaranteeing that? I said, in case he has a COVID, I will be with him in the COVID ward, that make sure that he's well taken care of.
Wow.
And I'm sure Dr. Rao took my words, because I visited that your LV Prasad 2 times. Dr. Rao visited me over 2 or 3 times. He took my word and he allowed Dr. Niranjan to stay here. So in this pandemic period, he has shown what a person of commitment and dedication can achieve. In other words, simple layman words, where there is will, there is way. And I heartily congratulate Dr. Niranjan. And whenever I'm back in Liberia, before he's gone back to India, I'm sure I will speak to the highest authorities in the country that he receives the honor he deserves for what he has done in Liberia. Even I spoke to Dr. Brown. He's the administrator and the head of the JFK hospital. And he was declared during Ebola crisis in 2014 in Liberia by the Time magazine the Man of the Year. Currently, he's heading the IMC, Incident Management Committee, and he is the head of the whole COVID hospitals in Liberia. Such a committed doctor. He has word of praises for Dr. Niranjan. The kind of surgeries he has done for children, especially children who are having different diseases in eyes. He explained me that one time he was in the surgical room. He was coming out after performing a surgery. He saw a number of children with waiting to get operated. Then he asked, these children have these diseases in eye? He said, we never knew that this is it until Dr. Niranjan came in. So these are some of the comments I want to say. I can talk for hours on this issue, but these are some of the comments I want to talk about Dr. Niranjan. Once again, Dr. Niranjan, I personally congratulate you for this award, and you have done so well, and you have brought laurels to yourself, to Liberia Eye Hospital, to LV Prasad in Liberia. Thank you once again.
Thank you so much, sir. All this would not have been possible without the support provided by you. Thank you so much.
Sir, we will take leave and have a good day, Dr. Niranjan, and you have a long day with surgeries, I know.